Welcome to MeAndMyPhysician.com. This is an opportunity execution project from Stanford University Novo Ed Technology Entrepreneurship Class Part 2, where you will be learning about MeAndMyPhysician.com, where you can connect, learn, manage your wellness. At MeAndMyPhysician.com, we find better healthcare through the people you trust. At MeAndMyPhysician.com, we want to empower your healthcare with an online social networking platform to all patients, doctors, specialists, hospitals, yoga masters, nutritionists, universities, treatment centers, medical associations, organizations, and much more, connecting each other through a professional networking system similar to LinkedIn and Facebook. Currently, there is no compelling source for patients to know the best healthcare providers available to them. There's no real information for best physicians or specialists or hospitals. There's no real effective platform for patients to share feedback, and long waiting hours to refer physicians. There's currently a very primitive healthcare appointment system. Patients are not empowered with the current healthcare system. Now they can with MeAndMyPhysician.com. The current solutions that are available, such as RateMD.com, ZocDoc, and DoctorScore.com, lack the trust from anonymous feedback. They also lack a community-based interaction by one-time users and visitors. The practice management solution is non-effective. Patients are not empowered with the current healthcare system. There is no effective means to know the best healthcare providers that are out there. At Me and My Physician, we conducted a survey that encompassed 10 countries. 76% of that was done via social media, and 90% of them were between the ages of 20 to 40 years old. Within that, 56% indicated that they were not happy with their current healthcare provider. 40% were referred by families and friends, and 32% looked upon websites. 51% of them were willing to change the healthcare provider that they had, and they had changed. 76% were willing to spend extra time and money for better healthcare. Me and My Physician wants to provide patients the ability to connect with family, friends, and physicians, learn and find better healthcare providers for their network, rate and comment on the services they received, find hospitals, pharmacies, and insurance providers, and manage all of their healthcare needs within one portal. We also, at MeAndMyPhysician.com, want to provide physicians and healthcare providers with connecting and managing with their patients within one portal. Stream appointment system within that portal. Advertise and connect with patients within their community. Best rewards and best services, a win-win solution. Me and My Physician wants to be the next big thing. Similar to Facebook and LinkedIn, where Facebook is the social network and LinkedIn is a professional network, Me and My Physician wants to be the healthcare network. Here you can see a patient page where they can manage their appointments, their medicines, track their payments, and see their insurance, where they have their appointments and their reminders, their history and messages, and also their networks, where people like them, their physicians, their hospitals, their clinics, and their pharmacies. Here you see a physician page where there's details on the physician, such as his age, his gender, where he's located, his specialty, and his phone number where you can connect. Here also you'll also be able to see the ratings and patients' comments and ratings on this physician. There'll also be the network where the consulting patients and his network, his hospital, his clinics, and his pharmacy recommended. Here, we want to empower your healthcare at Me and My Physician by providing a social network. Here you can see a physician page where you will see details and a profile, such as his age, his gender, where he's located, his specialty, etc. His appointments, his ratings that he can manage, and also messages from doctors or specialists or organizations, or also his patients. Here you can see the patient page as viewed by a physician, where he can, before an appointment, allow for him to see the history of this particular patient and the appointments that they have. Here's a hospital page, a page view for patients, where you can see the ratings and patients' reviews, etc. Our target users are urban wired young individuals, business professionals who are low on time, middle class to middle class and affluent individuals. Our team that we have collected together through this Stanford course is very passionate and have common views on creating affordable health care for everyone. Each one of the proposed revolutionary ideas are being discussed and debated within this organization. Each one of us has separate assets that bring this team together. Here's our business model. You can learn more about it by visiting the NovoEd site here below. This is why we think it was work from a physician perspective. Physicians are highly engaged with their online networks. This is why we think it will work from a patient's perspective. The marketing that we are utilizing primarily focus on our website at meandmyphysician.com. We're going to be doing SEO, search engine optimization, and SEM, search engine marketing, direct mail, and social media. Our brand ambassadors are founding members, our board members, universities, and hospital representatives. Our communities, with local communities at hospitals, universities, towns, and cities, will be created to spread the features and benefits of the website and invite people to join our communities. We will also be providing blogs. Founding members shall contribute to writing blogs and invite guests, writers to write topics about the full potential of our website. We also will have presentations via the YouTube, which this will also be on, and also to learn more about meandmyphysician.com. We will also be providing within our social media, Facebook, Twitter, and LinkedIn, where people can continue to be updated on the current status of where meandmyphysician.com is. Our revenue model and sources of revenue are as follows. We want to provide a revenue model similar to LinkedIn. On phase 1 or year 1, our users are primarily patients. Our paying customers would be utilized by the ads from healthcare providers. In phase 2 or year 2, patients will be primarily the users. Our paying customers will be patients and doctors using our premium services that we will be providing. Phase 3, which is year 3, patients and healthcare providers will be using the system, and it will be more of an inclusive platform. Our paying customers will be doctors and healthcare providers through added features. 2.4% of $1.33 billion estimated in 2016 for online ad spending for healthcare. 1.2 billion visits made in 2010 by healthcare services. 55.5% visits made to primary care physicians. 75% of our respondents willing to change physicians for better health care. 100% of physicians willing to pay minimal fees for new referrals. Out of the total estimated market size for year one, we see Me and My Physician revenue services as below. Referral services from physicians will estimate at about $500,000, equaling 100,000 visits plus $5 fees per visit. Online ads from healthcare service providers at 10% of 2.5% of 1 billion, we estimate our revenue to be 2.5 million. A total within the first year of $3 million. A total estimated market size for year 3. Referral services from physicians at 500,000 new visits plus $5 fees per visit is $2.5 million. Online ads from healthcare providers, which we think we'll be able to by year 3, cover 30% of the 2.5% of 1.3 billion spent within the healthcare, which is a total of 7.5 million. Premium users we feel is 2% of those 1 million users at $240 per year, of equaling a $4.8 million. New features such as online payments and insurance claims, online medicine ordering, etc., that we want to provide by that year 3, we see a revenue of $5 million, with a total within the year 3 of $19.8 million. Here you can see a timeline of investments revenue that we propose. Our risks that we view are as follows. 50% of the respondents from our survey were not comfortable having the rating system and having the feedback publicly displayed immediately. There were some privacy concerns that we need to address. Alternative solutions for negative feedback that we have recommended, that in regards to some of them, regarding the physicians in particular. The physicians would be happy if the feedback system was sent to them before mutual approval, and then with mutual approval and then published. If the review is negative, then the physician would like to discuss that with the patient and try to improve that. So finding a system within our system to be able to provide that for them. We want to thank you for taking your time and listening and learning about meandmyphysician.com. I will also be providing some additional slides that I will just let you look at. And if you have any questions at all, please don't hesitate to contact us. Please visit us at meandmyphysician.com and our LinkedIn and Facebook sites at meandmyphysician.com. We encourage you to learn more. Thank you.
You and I here all alone, Sunday morning here at home. The sky is blue as the coffee's strong. It's true.